Prostate cancer is the second most prevalent cancer amongst men and the fifth leading cause of cancer death in men. The majority of men who receive a diagnosis of prostate cancer will be asymptomatic. This is a cancer that we detect on direct screening rather than signs and symptoms. Some of these signs and symptoms that you should be looking out for is difficulty in urination, blood in your urine, blood in your semen, erectile dysfunction, and urinary retention. These symptoms, however, are not specific to prostate cancer. One of our more common differential diagnoses would be that of benign prostate hypertrophy, and that's when the prostate enlarges on its own. I want to point out to you that screening test called PSA, or prostate-specific antigen levels, are not a very accurate test for screening for prostate cancer. There's an incidence of prostate cancer of 25% in patients with a PSA level of between 1 and 4, and in patients with a PSA of higher than 10, the diagnosis of cancer can be as high as 50%. So when should we start screening for prostate cancer? Most people will say from the age of 55 onwards. But if you have a direct relative, in other words, a brother or a father, who has had prostate cancer, you should start the screening process much earlier, no later than 40. If we have a family history, uncles, grandparents who had prostate cancer, again, this should be happening far earlier, as early as from your 40s onwards. As I said, PSA is not the most sensitive screening test. Therefore, it's important to visit your GP or urologist. In my practice, I always tell my patients, if you drive a Ferrari, you do not take it to the corner mechanic for its service, for the simple reason the corner mechanic doesn't have all the equipment necessary to diagnose and or treat your Ferrari. Visit your urologist. The best way today to screen for prostate cancer is to actually visualize it. It's not only a digital rectal examination, but we can do this now with direct sonar imaging. The month of November is called Movember, where we bring highlights to and about men's health and wellness. Take the time to have your screening done.